What are the surprises now that you've spent time in it and you've gone into first in man and we've got clinical activities going? What has been the biggest surprise to you?
Yes, that's a good question. Firstly, I think that for any serious new technology with an unmet need, there is always a massive resistance to change. And Tim and I could speak to the fact when we did our own diligence in these areas, that the almost the resistance tells you there is a need. You've got to convert the community, and finding the right people to work with, like Stephen and Roberto, gave you a bit of confidence. Gave you a bit of confidence that you were heading in the right direction. So what I enjoyed about this, and maybe I should just say that this isn't my first rodeo. I formed a company that started phased array intravascular ultrasound, which is now part of Volcano, and I've got other companies that I've been party to. And so I looked at, first of all, there being a real unmet need, because I think that physicians will buy into an idea where there is nothing else, or where they know that the current treatment is particularly a disaster. And for those of us around this call, we know that amputation, which seems like a cure, is actually a way to hasten the patient's death. We know that the morbidity and mortality after amputation is horrendous. So it's not a cure. And when Stephen did the first few cases, it was obvious, and we didn't really know totally how to do the cases, but we were learning. But as we did that, we got markers for there being the potential for incredible change. We saw wounds heal that had not healed in 3 to 5 years. We saw infections remit, and we saw people get back their use of their limb and not develop renal failure and not develop cardiac failure. So in the early cases, we got little indications that this could be a game changer. So I think that's what drove all of us. And I go back, this is not iterative treatment. It may be a little bit iterative in that, as I said, Josh McCower had the idea to do this on the heart. Good idea, but didn't work. But when I looked at the literature, cardiac surgeons had occasionally, by intention, put grafts on veins in the heart instead of on the arteries, where the arteries were so diseased, and the patients got better. So there was anecdotal evidence that this sort of thing worked. And so to see Stephen and others learning the technique and seeing the benefits of patients, and having some patients say, oh my God, my pain's gone away as they come off the table, was just stunning, and made us feel like we were onto something special. And I can remember Tim telling me the first time that the patient, I think in Florida, had said after the procedure, oh my God, the pain's gone. I've had that pain in my leg for years and it's gone. It was just such it almost brought tears to it did bring tears to my eyes, that this thing was going to work.
Steve, I see you nodding your head very aggressively on the other side of the globe there. Tell me about the very specific moment when you knew that this was going to work. What were you doing? What were you in the middle of? If you can share that.
Yeah, I think that just thinking about the story always brings a smile to my face. I was just a regular Joe sitting at a conference at VEITH and listening to a couple of lectures, and I heard a vascular surgeon in Thailand, Professor Pramuk, present his data on surgical DVA and his experience with no option critical limb ischemia and using this method of perfusion. I spoke to him after that, and I did a surgical procedure on several patients and had great results. But of course, it being a surgical procedure was technically challenging, doing an anastomosis from a vein to a vein. Really, we were in the true Wild West. We didn't really know what was going on then. But we managed to get a good result. And intuitively, the next step for us was reach for the skies and to try and perform this procedure with endovascular means. The first procedures were tough because we had to learn everything from scratch. It took a great leap of faith, experience of prior literature, as well as experience of other surgeons. And we had to learn as we went along. We were lucky, we managed to get good results, and with a lot of perseverance and a lot of sweat. And of course, the patients endured the journey together with us. I think we had a good result with the surgical cases, and then we went to the endo cases with some off-the-shelf devices. And the rest, as they say, is history.